everybody. Welcome back to Pickleball Physio, a podcast where we talk about pickleball injuries and recovery and protection. So pickleball athletes can stay on the courts longer, get back on the court sooner. And I'm super excited for this episode. I've got Dr. Coach Kev Melendez. He's on with me today, and he hails from Florida, and I've had the pleasure of getting to know him through our business coach and just as physical therapists, and getting a chance to meet him over the course of the last year. He's got so many amazing things to bring to the health and performance and wellness community. And so I'm really excited to have you on. Welcome, Dr. Coach Kev.
Thank you so much. I can't believe it's been almost a year now since we've met. Isn't that crazy?
Yeah, it's really, really cool. The year goes by so fast, and you have grown immensely in what you're doing. I'd love if you could share a little bit about what you're doing, where you're at, and how you're serving your community.
So I am located in technically the Oviedo, Florida, but really it's Orlando. We're probably 10 minutes from the UCF, location. It's called SWISH Physical Therapy and Performance. We are a out-of-network performance facility where we focus on not just recovery from injury, but also preventing injury. So the whole spectrum of care. It's not just, hey, how can I get you back from injury to baseline, but those who are at baseline or doing better, it's like, let's keep you as active as possible and keep your quality of life as best as we can.
I love it. And that's so important because a lot of times, I know you and I understand this, a lot of times when people come into physical therapy, they're usually at that injured stage. Mm-hmm. And typically in network facilities, we only get them to prior level of function. So what has that been like for you, helping to educate and reframe the clients that come through SWISH PT?
Well, when we first started, it was maybe because we were just used to the traditional format where it was like, all right, how can we get people to baseline? How do I, and what I started realizing was that there's so many people out there that might not be at injury. They might not be at injury where they feel, oh yeah, I need to go to physical therapy, but there's definitely things that bother them. There's definitely things that are keeping them from being at max quality performance. Whether it's them playing pickleball, or whether it's them playing basketball, or whether it's just them doing their daily activity, but they're not injured enough to go, hey, I need to go see a physical therapist, or I need to go see a doctor of some sort. And so what I came about is like, okay, I need to create something that allows me to tap into the community to let them know that they don't need to wait until, quote unquote, their body is injured. And how I compare it to is like until their car's on the side of the road before they realize they need help. So reframing the mindset of what physical therapy should be, which is our ability to not only get you from injury, but also how do we maximize your performance?
Yes, absolutely. And I like the analogy that you use about making sure that you're, doing checkups even with your car to make sure it's not broken down before you address it. And you have something like that in your clinic that you've been using for the community. You call it the full body diagnostic checkup. Can you share a little bit more about that?
Yes, hopefully I find a better name that's more like trademarky, but until then, yes, it's the full body diagnostic checkup. And what it essentially is the best metaphor I've been able to come up with is a vehicle. Like our bodies are made to go from point A to point B, right? Mm-hmm. That's straight up what our body is, to be able to do job from point A to point B. So just like a car. Well, we know we're supposed to get our oil changed every 5,000 miles. We know we should get our tires rotated. So, every so often, like we know we should get our, all that stuff should be checked. But we ask ourselves, okay, well, what do we do in our bodies that we check? Well, we know we should go to the dentist once a year, right? At least. We know we should go get our vision checked, right? But then ask yourself, why haven't you been told or have the resources or even know that it's possible to get your entire physical body checked? Your mobility, your strength, your balance, and your functional movement assessment.
Yes.
And the answer to that question is, well, the reason why that's not a thing, one, is because the healthcare system makes too much money off of tertiary care, which is when you're injured. So if the majority of injuries happen from back pain, from knee pain, from hip pain, from ankle pain to neck pain, and they make the most money off of back surgeries, hip replacements, knee replacements, then they don't want you to be preventative about checking your body, because then it kicks you out of the vicious cycle of you need to go to the emergency room. You do need to go to your primary. You do need to go to the hospital, so on and so forth, and then go to the surgeon. So it takes away that part of the system that they have yet to learn how to monetize, which is preventative care.
Yeah.
And what we do here with the full body diagnostic checkup is check all those things. And we tell people optimally, you should do it twice a year to check if you're getting better or worse. And we show objective data. So you can see literally like by numbers, oh, I am getting better, right? Or, oh, hopefully not, but oh, shoot, I'm starting to slide down a little bit, but you get the actual measurements. So I'm not just coming in and being like, blah, blah, like, oh, breathe in and breathe out. It's like, no, this is what an actual physical should be. You are we are breaking down to see how your body is moving and functioning. And then you can see directly how your car, quote unquote, is performing.
Absolutely. And I love the analogy that you give with the car, because everybody understands cars. Most people, even if they don't drive, they hear the language and it's very familiar to them. And those elements that you mentioned that we need to have checked up have to do a lot with our movement and our mechanics and our internal strength and stability, which we love our physicians because they help check to make sure that our vitals are good and that we're alive. But that's where physical therapists really shine, is our ability to assess the human body and our movements and our strength in that way. And I think that that's a really important thing that you highlighted there with what your full body diagnostic checkup can give. And again, I know you're trying to find like terminology for that, but I think that language is enough to, get people's attention because they understand what a diagnostic checkup is for their car. So you had mentioned like strength and mobility and stability, functional movement, and that are those kind of your main elements, or are there other elements that people should be aware of that come with your full body diagnostic checkup? What are things that you are looking for or that people should be keeping an eye out for their own understanding?
So it goes back to, I always say that the full body diagnostic checkup is a mix between my clinical experience, evidence-based, and technology put together, right? So the technology portion of it is literally seeing the objective data. When we look at the amount of force through the dynamometer, we can see the exact numbers that you're pulling, right? The clinical experience, all right, well, what are some of the signs and symptoms of the most common things that happen in life, right? Majority of people, there's a lot of people that deal with back pain, a lot of people that deal with neck pain, a lot of people that deal with knee pain, wrist pain, whatever it is. And there's common signs and symptoms or tests and measures that we do based on our clinical practice guideline, which is the evidence portion of it, right? Where we go, okay, people mainly, if they're presenting with, for example, cervical radiculopathy, right? It's a fancy, for people who are listening, it's just neck pain with, any sort of like ridiculous symptoms. So like numbness and tingling down your arm or in your shoulder or in your, your shoulder blade or down your, whatever. The signs and symptoms we see for that is decreased cervical range of motion, decreased grip strength, right? And the numbness and tingling. So if I'm looking at your mobility, one of the tests we do is cervical range of motion, right? So cervical rotation, and we're also seeing grip strength. So if you see there's a dramatic, difference, or one person is one side is, instead of being greater than 70, we see it at 55, but they've yet to maybe not get the numbness and tingling, then we already know right away, hey, this is a yellow flag. We need to work on this. That way you don't get this. Right. So to answer your question, I guess that's the mobility. That's like a mobility aspect of it. Right. And then for strengthening, we know based on my clinical experience and research that we want asymmetry to be as little as possible. Right. So we look at it to be under 10%. Yeah. Right. So when we're testing your muscles, we're testing each side, and you can see through the technology directly as you're doing it. Oh, wow, I'm at a 50% asymmetry. That's not good, right? Okay, I'm at a 12. Okay, that's not bad. 13, 14, 35. Whoa, wait a minute. That's not good. So you start to see the difference between one side or the other, and that's where it comes in. So that's mobility, where we check the range of motion for your ankle, knee, hip, back, shoulder, neck, and then the strength, we do hip, knee, ankle, and then the balance we have force plates. So through our force plates, we're getting real lifetime interaction of how much medial lateral shifts, or how much your ankle is moving side to side and forward and back, based off real life intuitive technology that you can see as you're doing it. How cool. And then for the functional movement assessment is when I get to see how does your squat look? How does your lunge look? How does your side lunge? How does your hip hinge? And then your push and pull. And that we break that down and kind of tell you like, all right, what are the top 3 things that you need to work on? And then you work on them either by yourself or this is where I come in, which is our SWISH subscription.
Yeah.
Right. Which I work with, up to 25 people a year who go, okay, I did my full body diagnostic checkup. I see the things I need to work on, or maybe there's things that I don't need to work on, but I want to make sure I stay that way.
Yeah.
Right. And then we have a year-round recovery system where I see them, depending on the plan, either twice a month, 3 times a month, 4 times a month. And so you can either do the diagnostic where you kind of just come in for your annual or biannual physical, or you can choose to be a part of the subscription, which we work together for the year.
That's so awesome. And I think that's really cool how you are giving that live real-time evidence and data for the individual, because patient education is such a huge part in people being able to take advantage and really be independent and empowered with their fitness, with their health, with their performance. So I love that you are able to kind of find this beautiful harmony of your clinical experience, the evidence that we have to support, and then the technology so that patients can see for themselves too, and be able to be active participants in their journey.
Yeah.
So with go ahead.
No, I was just gonna add, like, my based on feedback of patients and even our own experience, like, what frustrates you about when you go see your primary physician, you go see another doctor's office? Like, patients will leave out of there and be like, I had no clue what he was looking for. Right. He was only there for 5 minutes. He didn't explain what he was really, like, in layman's term, what he was looking at. He didn't even show me any numbers. He didn't show me anything. Like, I just have to take his word that there's something's wrong with me. Right. Like, those are the complaints. So I looked at it and said, okay, how can we take all those complaints out and make it so proactive for the patient from a customer experience standpoint, but also, like, understanding your own body from an education standpoint? Because what we know, and you said it amazingly, and I'm so proud for you for saying this, is the number one thing that helps patients is patient education.
Right.
Like, that's not just me saying that. Like, our clinical practice guideline is based off 10 plus years of research that shows every highest level of grade of helping someone is education.
Yes.
So if you can see and learn how your body's working, you're going to understand yourself so much better and feel better.
Right. And I'm sure that's something that you've also experienced just in your journey of going through PT school or any experience with physical therapy. And me as well, is like, the more that I've learned about my body, I'm way less afraid when things are happening to me, because I can understand and kind of tease out and suss out what's going on, because I have that awareness of my body. And that's something that we're offering the opportunity for our patients and our clients to experience as well. And all of the times that I have ever interacted with people and they're talking about their healthcare team or whatever, consistently, whenever they're praising someone, it's always the first thing they say is, they took the time to explain it to me, and now I understand what's going on. And so I think that's a wonderful thing that you guys have the time to highlight, because of the way that your business is structured and the way that you guys are able to show up for them in your subscription. So one thing that I wanted to ask about that is, tell us a little bit more, because I want you to be accessible and for everybody in the Orlando, Oviedo area to be aware of what you have there. Because I know there's a lot of pickleballers out there, and I'm sure you've seen a couple people that play pickleball. So I want to send them your way. Like, what does your subscription look like? What can someone expect when they come in and they get their full body diagnostic checkup? What does a subscription look like for making sure that they stay healthy or stay fit and performance? Because I'm sure, like, it varies with athletes depending on if they're seasonal versus a year-long sort of a commitment. Share a little bit more about that.
I would say, so we have the full body diagnostic checkup is for anyone. And it's definitely anyone that's walking on this, or not even walking, literally anyone, like, it's like, can benefit from it, because it's a physical, right? So it's how your body's working. What we've noticed with, I'm fortunate enough to work with people who are active and athletes and actually a few pickleball players. Honestly, it's probably the fastest growing sport in the world.
Absolutely is.
By far. But the cool thing about it is, what I say is, like, it's the first thing, right? I actually people can't just come in and be like, hey, Kev, can I get a recovery session with you? I'm like, absolutely not. I have to see how your body's working first. Right. So to even be eligible for a subscription or be eligible for any sort of further recovery, you have to do the full body diagnostic checkup. Right. Smart. So for anyone who's playing, You do that, and then, which by the way is a proud to pay system.
So tell me more about that.
Which is yes, I'm extremely proud of this, because another complaint that people had when working with doctors is, it's so expensive, or I don't know what the heck I'm going to get charged until the end of it, or I'll get a bill randomly at 6 weeks later. It's like, oh my God, what the heck is this? So this is what's called a proud to pay, which is you pay whatever it's worth to you at the end of the visit. So it's worth a $300 value, but whatever it's worth to you at the end of the visit is what you pay.
Nice.
And what that does is, it allows the physician, which again, people complain, oh, they're just coming in, I'm just a number to them. Well, if I don't know what you're gonna pay, I'm gonna treat you just as well as I'm gonna treat somebody else.
Right.
Right. So now it forces the physician and us to go, you're gonna get the best of me.
Mm-hmm.
Right. So, and then at the end of it, I don't care what you pay, because first of all, my real main objective is, yes, I hope you value it so much that you're willing to pay for it. But also it changes the narrative. It allows more opportunities to change the narrative of what physical therapy can do for people.
Yes, absolutely.
Right? And then the subscription allows us to go, okay, remember, we only do a certain amount of people per year.
Right.
So the faster you jump on it, the better. In the first month we did 9 subscriptions, and we're only doing 25 for the year. So we have 16 slots left. Right.
Awesome.
So
awesome.
I always tell people, like, jump on it as fast as you can if you want to be a part of it, right? But at the very least, do your diagnostic checkups. That way you can stay up to par with what you need to do. The cool thing is, once and then whatever you pay towards the diagnostic checkup will technically go towards your first month of the subscription, is how we look at it.
So it's just another investment into yourself, no matter what you do.
No matter what you do. So the big thing with it is to go, okay, here's how we can help as a therapy. And the ultimate goal from a profession, the reason why I'm so passionate about it is because I think it's a step towards outpatient physical therapists being the primary provider for musculoskeletal injuries, right?
Yeah.
The same way that people now go, oh, I need to go get my vitals checked. I need to get my prescription for blood work at my primary. I want people to start thinking, oh, it's that time of the year where I got to go get my annual physical at a physical therapist.
Right. Which
that's how I feel.
Yeah. Which I love, because there's a lot of times whenever people see their primary care physician, they end up coming to us anyway if they are complaining of pain, whether they're having to figure out, like, oh, are they a candidate for surgery? Well, most of the time they want them to do some sort of prehab to help optimize their chance of recovery after surgery. Or if they're not a candidate, then they'll try to do physical therapy anyway, because a lot of times physicians know that's our specialty. That's what we're here for. So I think that's really cool. By posing it in this proud to pay system, it asks the clinician to have integrity showing up for the clients that walk through their door, but then it also helps the community see, oh, like, I'm going to end up seeing you anyway. So like, let's just make this a regular thing already and bypass the middleman. And in that too, with you only having 25, memberships available each year, that gives you even more time to spend with each person that comes through your doors. Yes. And that's a part of that subscription.
Yes, the subscription, what it is in detail is that depending on which one you do, which is the SWISH Lite, SWISH Pro, or SWISH Pro Plus, the big difference is the amount of visits you get. So the SWISH Lite is 2 times a month, SWISH Pro is 3, and then SWISH Pro Plus is 4 times a month, which really is a total of like 52, and you can use it however is needed. So Let's say you have a hard in season, then okay, maybe we'll see you a few more times that month. So it's just a total amount, but however much. On top of, you get a exercise library where I go in detail of showing, exercises that we do. That way, when you're at home, you can do them. We also do, you have accessibility. It's only 25 people that's on my caseload. So at any, you can text and call me, and I'm going to get back to you pretty fast because I don't have a heavy caseload. Right. So I'm your personal doctor. And you're not just a number. Well, I guess you're one of 25 if you want to be specific, but you're not one of a big number, I would say.
Yes, which is amazing. And I think that's something that people really value, is knowing that, oh, you're not just trying to get us through. They actually get more time with you, and that accessibility, because that's another thing that a lot of people value, especially when we're athletes or when we're trying to plug into our community. We want to have access to the people who have the answers that we need, the answers that we're looking for, and to help ease our minds. Again, back to the patient education, just every way that you're posing your business is making that education, that that knowledge accessible to the clients that are around you, which it's really important, especially in the pickleball world, because as many of my listeners know, and I'm sure you've seen as well, there's a lot of injuries that are starting to show up in the pickleball community because it's such an easy sport to pick up on. You learn the game fast and people put away a good shot and suddenly they feel in their mind that they're 20 years old again. And I mean, I know that's not too far away for some of us compared to the majority of the population playing pickleball, but even still, like our bodies are getting older and we have to respect the changes that it goes through. So being able to have this checkup gives us a chance to know exactly where we are at any given point of time so that we're not overdoing it when we go out on the courts and playing for hours on end and not realizing that we have asymmetry in our body. So I love the opportunity that you're giving the community out there to be able to have that awareness of themselves. And so one thing that I wanted, go ahead.
No, I was gonna say that, and the big one too is like, because we talked about it a lot, but like about the injured individuals, right? But the cool thing is I want people to understand, like, do not wait till you're injured. Right. That's the big one. It's like to have the mindset of, we don't want you to be injured. We are a proactive like profession. We want you to run smoothly. And the big caveat that people I think don't think about is when you play pickleball or when you play basketball or when you play whatever, or when you're training for something, that puts stress on your body. That is completely different than recovery. So every time you play pickleball, you are actually headed in the direction of injury. That's what people don't put together. Whenever you live life, whenever you go to work, whenever you lift something, you are headed in the direction of injury. What you need to have is something to counteract that, which is strength and conditioning and recovery. So AKA, performance physical therapy, which counteracts that and heads you in the direction of performance or healthy. So people think, oh yeah, I play pickleball all the time. Yeah, you're little by little beating your body up to go towards injury. It's only a matter of time. Right. So that's why I always tell people, go get checked, but also make sure your recovery is a big part of your process, because that's opposite. It's different. That's a different type of stimulus you're putting on the body, which keeps you active.
Absolutely. And that's something that I think is really special about physical therapy, and the way that a lot of us are trying to trend is by emphasizing this recovery period, especially in the pickleball world where people are playing for hours on end. They're not giving themselves enough time to rest and recover. They're doing like 3 to 5 hours a day, 5 to 6 days a week. It's like, where are you getting a chance to let your body be able to recover itself and prioritize your performance after that? And so in an ideal world, right, people would be getting these diagnostic checkups twice a year or before they're getting involved in a new activity, just to make sure and screen that they're clear to go into this and know exactly what to ask their body and how to take care of it on the back end.
Exactly. And if a lot of the reason why I created what I created is because I always tell myself, what would I have wanted when I was 16, 17, 18, 20, 21? Like, I literally always say, if I would have had myself, I would have avoided all my injuries. That to me is like such a cool feeling for me. Like, I know it's kind of like, that's my North Star. Like, how would I have avoided my own injuries? Absolutely. And save so much money, save so much time, proud to pay system. Like, you can go get checked 4 times a year. Who cares? You're just literally seeing how your body is continuously moving throughout your life.
Yes, absolutely. So on that note, especially because you're talking about like, oh man, if I had a me back then, what are some recovery strategies or recovery routines that you have set in place for yourself? Because I know that you're training, well, we could talk about this too for a little bit. I know you're training for an Ironman. So with that, you have to respect your body as you're training. How are you taking care of yourself for that performance and for that recovery?
So real quick, it kind of sucks. There was a personal things that happened in my life where I have to actually bow out of the Ironman. But I will say I am training for a basketball season that's coming up, adult basketball season, and so I'm excited for that. But to answer the question, I always say I gotta probably teach my coworker / brother to like do some manual therapy on me somewhere. But I definitely make it a conscious effort to know what my limitations are right? So my hip mobility, my lumbar, mobility, my hamstring strength. So I'm proactive about what I have to do every day. And that's what, so I set out time for mobility. I set out time for strength. I set out time for, just soft tissue on my own. But yeah, so I'm definitely like not hypocritical about it. Like, let me wake up, spend 10 minutes in the morning to do some stretching, because it goes, I always tell people mobility, strength, then core, and then speed / acceleration and power / motor control. So that's kind of the continuum that we go. So what I always say is make sure you have your mobility right. Make sure you have your ranges of motions in as normal as possible and as regulated as possible. And then you strengthen and make sure you maintain all that range of motion. And then you add speed and power to that range of motion and strength. Right. And then you have to coordinate and be able to control all those variables. So that's what I always, that's kind of how I break it down to people.
Which is beautiful, because especially with a lot of pickleball athletes, a lot of people will just jump into a game cold turkey. They'll show up at a court and they'll have friends out there saying, hey man, we need one more, come join us. And they'll be fresh out of bed, maybe had a breakfast, and they'll jump on the court. So I love the emphasis on make sure you've got your motion, you've got your mobility, you're strengthening into that motion, and then you're giving your body a chance to warm up and coordinate all of these movements all over again. I mean, another example that I have heard people say is like, when you look at your dog, when they get up from lying down, what's the first thing they do? Stretch. They stretch and they get their body moving. Sometimes they'll shake it off, because that's just a way that they tell that their body that they're starting to get going. They're starting to get moving. Why aren't we doing the same thing for ourselves? It's imbued in nature around us. And so I love that you mentioned that's how you start your day. And that's something I want to encourage the listeners to do as well, is start your day with some just gentle stretches, some gentle motion, and get those muscles woken up and get that coordination and motor control in, so that by the time you get to the courts, your body's already primed for an activity for the day and you're not at risk. Again, it's back to that primary prevention. You're not at risk of injuring yourself, even though you know that you're going to be putting stress on your body from playing, which I love.
Yeah. And then the big thing too is when you do the checkup, like the full body diagnostic checkup, you are self-aware and knowing, like, let's say you're limited in time, you know what you specifically should be doing to warm up. That's the big one. A lot of people come in and be like, oh, my hamstrings are really tight. And then we do a 90-90 hamstring test and they're completely fine. You go, no, you're weak. You need to be starting off with RDLs and single leg RDLs to warm up versus stretching, because that actually is putting you at an increased risk of injury. So knowing how you specifically need to warm up is such a gem. Like, I don't think people understand enough. Like, if you come in and you have normal hamstring length and you're stretching hamstrings, you're wasting your time. Right. And you're actually increasing your chance of injury.
It's not the proper strategy for you, which is why it's so important for each person to know what is happening with you. That's why we always see, don't start any exercise program without checking yourself out first, because you need to make sure that that exercise program is fit for you, is focusing on the proper strategies that your body needs. Why go through a 1-hour workout when maybe you only need 3 to 4 exercises in the given day to keep yourself in tip-top shape?
Exactly.
Yes.
Exactly.
Absolutely. So one more question I'm wanting to start asking people as they come onto the podcast is, who is a part of your wellness and performance team?
Who's a part of my wellness and performance team?
Yes.
In what variable? In what way?
In any regard. So for example, if you're seeing a trainer, if you're working with a dietitian, if you're working with a therapist, if you're like, in what ways are you fulfilling elements of your life to help keep you in the best shape for your performance and your wellness and what you're doing? Because it's not a solo journey.
No, it is definitely not. I would say that it depends on it's funny that we talk about physical health, but there's definitely mental health, there's emotional health, there's intellectual health, financial health. So it depends on what part of my life I'm in. It requires certain teammates or to step up a little bit. So physically speaking, from a physical health perspective, I do a good job of being able to have that, right? That's my specialty. From a mental health perspective, I definitely tap into a therapist every so often. I'll have, I like to go for like a 2-month, 3 months, and then kind of cycle off and practice the things that I've learned.
It's seasonal,
through life. And then financial, I'm fortunate enough to have a brother and a business mate who's really knowledgeable and understands the importance of that. So we talk on a weekly basis on, hey, how are you doing personally and business wise, and how can we make sure we stay on top of that. And then intellectual, I have one of my good friends loves to read a lot. So, hey, I have this book for you. I got this podcast. I got this video. So he'll send me stuff. I make sure I stay on top of that. And then emotionally, I do a good job of making sure to hang out with my best friends of over 20 years, at least once every so often, very, very, very regularly, to keep that part of me very sane. So that's what I would say, that team of it. And then my parents play a huge role in just making sure that I stay level headed and confident and so on and so forth. So that's what I would say. I that team of individuals that keep certain aspects of what we call health very balanced.
Yes, which is very important. And I want to encourage listeners to take a look at your life and who's on your team right now. And if there's any aspect of your life that is lacking, is there someone that you know of that can either be that person for you or connect you to somebody else that can be that person for you? Because like fitness and performance and wellness in life is not a solo activity. That's one of the reasons why we love pickleball, right? Is because of the community that we play with. So we need to make sure that we're addressing all of the aspects of our life to keep us on the courts, playing as many games as we want, and being with our community and meeting up with our friends for many years to come, which I love. So thank you so much, Dr. Coach Kev, for joining us on this podcast. It's been so much knowledge and so much value for the pickleball community, because especially if we can start reframing how we approach this sport early on as it's still fast growing, I think it's going to be a super healthy sport for everybody that comes into this world. So before we end, where can people find you? How can people get connected with you if they're wanting to follow up or follow your journey and learn more about how to take care of themselves?
Very easy. You can follow me on Instagram or any social media platforms, so Instagram, TikTok, YouTube at Dr. Coach Kev, or you can go to the website getswishpt.com to learn more. And if you're in the area, like I said, come by, let's do the full body diagnostic checkups, a proud to pay system. And the best part about it is that a portion of our profits this year will be going to the Orlando Magic wheelchair team.
Oh, so how exciting.
So we're really excited. So a portion of that. So again, it's just our way to be able to give back and understand the importance of making sure your body's good, you're good, and you live a happy quality of life. That's it's all about.
Awesome. Thank you so much, Dr. Coach Kev. And to all of you listeners, if you found value in this, please share this with your pickleball friends or any other family or friends that you think could find value in this information. Let's reframe what health and wellness and performance looks like so we can enjoy our lives for many years to come. We'll see you guys all next time.